callus. If there is an abnormal amount of pressure or friction onto the skin, it can become thicker and a callus can form. At the foot, at a prominent bone, for example, can it happen, and then it can become hard, thick, slightly raised, and insensitive, the skin. And there is oftentimes an underlying cause with that the pressure is not equally on all toes, or that there's someone working inwards. But the most cause is that the shoes are not well fitting. And a person can go to a doctor, and when there's looked, if there's an underlying cause, another disorder, there can be something of a skin paired away, and when advising on well-fitting shoes instead. And if such well-fitting shoes are worn, these calluses should go away without problems. And that is according to Keith Hodgkin's Family Medical Advisor book on page 105, but this is no substitute for medical knowledge and also no medical advice. Hi and welcome. I am trying to learn medicine, today Callus, and after we're done with it, we're going to do arm strength training. And if you participate in the arm strength training, then it's at your own risk. And we're talking about anatomy, internal anatomy, the blood system, and so on. And this is no medical advice, I'm just trying to read and to understand it. Callus. When abnormal pressure or friction is continually exerted on an area of skin, the skin thickens to form a callus or callosity. The most common site is the sole of the foot beneath a prominent bone. In nearly all cases, there is an existing disorder of the foot. For example, the toes do not take their proper share of the weight borne by the foot, or the foot is turned inwards when walking. A callus can form when there is an abnormal amount of pressure and friction onto skin, which can happen at the foot beneath a prominent bone. And in most cases, when there is also something like that the toes are not taking their proper share of weight, or that the foot is turned inwards when walking. Symptoms. The skin of the affected area becomes hard, thick, slightly raised, and insensitive. So, the skin becomes hard, thick, slightly raised, and insensitive. The duration. The callus remains for as long as the pressure continues to be exerted. Causes. Pressure from badly fitting shoes. So, most of the times, it is that the pressure is not equally on all toes, or that the foot is turned inwards when walking, or that the shoes are not properly fitting. Treatment in the home. Well-fitting shoes. Padding in a shoe may help to reduce pressure and pain. So to wear well-fitting shoes, maybe a padding can also help to reduce the pressure and the pain. Consult with doctor if the calluses are causing considerable discomfort. What the doctor may do is refer the patient to possible treatment of any underlying disorder of the foot. Okay, looking if there's another underlying disorder, like you're walking inwards maybe. Refer the patient to a chiropodist who will pare away some of the affected skin. So pare away, I don't even know what the word pare away, I can cut it off or something. There can be something removed of it, of affected skin. Advise the patient on any means of prevention. Okay, there's an advice wearing well-fitting shoes, looking if there's an underlying disorder of the foot, and maybe pare away some of the affected skin. Prevention. Wear well-fitting shoes, especially when young. They said to Bunyan that that is one reason why people who are not so old should take care, because the feet are, how was it written? They're easier deformed, and the pain is less felt during the deformation. That was already written, I don't know. Well-fitting shoes, and calluses almost always clear up when properly fitting shoes are worn. Okay, clearing up with good shoes. Okay, I'm going to stop a second, camera. The toes do not take the proper share of the weight. In hard, thick, slightly raised and sensitive skin. Underlying other causes. Hair away something advising. Okay. Callus. There can be abnormal pressure or friction on the skin, then the skin can become thicker, and that is when the callus. And that can happen at the foot. There is a bone too prominent or something, and when there are too prominent, beneath a prominent bone. Callus. If there is an abnormal amount of pressure or friction onto the skin, it can become thicker and a callus can form. At the bone, at the foot, at a prominent bone, for example, can it happen, and when it can become hard, thick, slightly raised, and insensitive, the skin. And there is oftentimes an underlying cause, the fact the pressure is not equally on all toes, or that there's someone working inwards, but the most cause is that the shoes are not well fitting. And a person can go to a doctor, and when there's looked, if there's an underlying cause, another disorder, there can be something of the skin pared away, and when advising on well-fitting shoes instead. And if such well-fitting shoes are worn, these calluses should go away without problems. And that is according to Keith Hodgkin's Family Medical Advisor book on the page 105, but this is no substitute for medical knowledge and also no medical advice. I'm going to close up the camera. And that was the medical part. If you were here for medicine, you can go directly to the next part of the medicine, where we will continue with medicine. If you stay here and participate in the Armstrength training with the arms, good and stable stance, and breathe in and reach the fingertips to the sides as fast as possible. And down. And in front. Higher. And big. And if the next exercise causes pain or discomfort, don't do it. Long arms with fists, circle the fists, and the arms. And change the direction. And now, the fingertips together. Don't press with full force. And if there's at any time pain at the elbows, wrists, fingers, or in particular the joints of the fingers, then stop immediately. And press with longer fingers. Again, your arms are stronger than your fingers, so don't press with full force. And if there's pain, stop immediately. And press with the fingertips into the thin arms of the other hand. If this causes damage at the skin or at the fingernails, don't do it. Press from the bottom into the hand and give the other hand. Press. And again. Press. In. Press. And now the other way around, with the other hand from the bottom. Press and get in. Press and get in. Again. And another time. One arm out and press and get in. Arm out, press and out and press. And last time. And now the hands together. If this causes pain or discomfort at the wrist, then don't do it. Press together. Over. Up. Over. Down. Middle. Change the direction. Over. Not full force. Over. And now middle to the side. Up. Middle to the other side. Down. And again back. Over. And now relax hands. Arms to the side. Circle the arms. Front. Backwards. Then one arm to the front. shoulder back, not down, pull the arm and have its fingers, relax the arm, go back with the shoulder and turn the palm to the sky. And the other arm in front, shoulder back and down, pull the arm and have its fingers, relax the arm. And go with moderate pressure over the middle part of the lower arm. Hand on the outside. And let's possibly arm strength training. I thank you very much, and until next time.